Hey, YouTube fam. Back pain driving you crazy? Well, get ready for a mind-blowing revelation. Vitamin deficiencies might be the sneaky culprits. Today, we're diving into the world of vitamins and their impact on your back. Buckle up and join us as we uncover the missing links between those pesky deficiencies and your aching back. Let's get started. Vitamin D deficiency. Vitamin D is a fat-soluble vitamin that plays a crucial role in maintaining bone health and overall well-being. One of its primary functions is to facilitate the absorption of calcium and phosphorus in the intestines, which are essential for the development, growth, and maintenance of strong bones. When you have a deficiency in vitamin D, your body may struggle to absorb an adequate amount of calcium from the diet. As a result, your bones may become weak and brittle, increasing the risk of fractures. This can lead to various musculoskeletal problems, including back pain. Vitamin D is unique because it can be synthesized by your body through exposure to sunlight. When your skin is exposed to ultraviolet B, UVB, radiation from the sun, it triggers the production of vitamin D in your skin. However, many factors can affect your ability to produce vitamin D through sunlight, such as living in regions with limited sunlight, having darker skin, which reduces the production of vitamin D, wearing sunscreen, or spending excessive time indoors. Besides back pain, a deficiency in vitamin D can manifest with other symptoms, including muscle weakness, fatigue, bone pain, frequent fractures, and even an increased risk of osteoporosis, a condition characterized by low bone density and increased susceptibility to fractures. Vitamin B12 deficiency. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a crucial role in various bodily functions, including the formation of red blood cells, DNA synthesis, and the proper functioning of the nervous system. Vitamin B12 is primarily obtained from animal-based foods, such as meat, fish, eggs, and dairy products. It is absorbed in the small intestine with the help of a protein called intrinsic factor, which is produced in the stomach. When there is a deficiency of vitamin B12, the production of healthy red blood cells and proper functioning of nerves can be compromised. In terms of back pain, vitamin B12 deficiency can lead to a condition known as peripheral neuropathy, which affects the peripheral nerves that transmit signals between the central nervous system and the rest of the body. Peripheral neuropathy can cause symptoms such as tingling, numbness, and pain in various parts of the body, including the back. The pain may be described as sharp, stabbing, or burning. Other symptoms of vitamin B12 deficiency can include fatigue, weakness, dizziness, memory problems, and mood changes. Vitamin C deficiency. Vitamin C, also known as ascorbic acid, is a water-soluble vitamin that plays a vital role in various physiological processes in the body. It is well known for its immune-boosting properties and its role in collagen synthesis. Collagen is a protein that provides structural support to various tissues in the body, including the skin, tendons, ligaments, and intervertebral discs of the spine. These discs act as cushions between the vertebrae, allowing for flexibility and shock absorption. Vitamin C is essential for the production of collagen, and a deficiency in this vitamin can impair collagen synthesis. Without sufficient collagen, the intervertebral discs may become weakened and less able to withstand pressure and maintain their normal structure. This can lead to disc degeneration, herniation, and back pain. While back pain related to vitamin C deficiency is not as commonly recognized as the association with vitamin D or B12, it is still a potential factor. The role of vitamin C in maintaining the health of the intervertebral discs suggests that a deficiency could contribute to back pain, especially in cases where disc-related problems are involved. In addition to its impact on disc health, vitamin C is also important for overall tissue repair and healing. It has antioxidant properties that help protect cells from damage caused by free radicals. It also supports the absorption of iron, aids in the synthesis of neurotransmitters, and helps maintain a healthy immune system. Food sources rich in vitamin C include citrus fruits, such as oranges and grapefruits, strawberries, kiwi, bell peppers, broccoli, and leafy greens. However, it's worth noting that vitamin C is easily destroyed by heat and prolonged storage, so it's best to consume fruits and vegetables in their fresh or minimally processed form to retain the highest vitamin C content. If you like the video, give a thumbs up button, and never forget to subscribe and click the bell icon. Magnesium Deficiency. Magnesium deficiency can potentially contribute to or cause back pain. Magnesium is an essential mineral that plays a vital role in various bodily functions, including muscle and nerve function, bone health, and energy production. Magnesium is involved in muscle relaxation and contraction, and it helps regulate calcium levels within cells. It also plays a role in the function of the nervous system, including the transmission of nerve signals. When there is a deficiency of magnesium, it can disrupt these processes, leading to various symptoms, including muscle cramps, spasms, and pain. Back pain associated with magnesium deficiency can be attributed to muscle-related issues. Magnesium helps relax the muscles, and when there is an insufficient level of magnesium, muscles can become tense, tight, and prone to spasms. This muscle tension and spasms in the back can result in discomfort and pain. It's important to note that back pain can have multiple causes, and magnesium deficiency is just one potential contributing factor. Other common causes of back pain include muscle strains, poor posture, herniated discs, arthritis, and other underlying medical conditions. Therefore, if you're experiencing persistent or severe back pain, it is advisable to consult with a healthcare professional for a proper evaluation and diagnosis. If magnesium deficiency is suspected as a potential cause of your back pain, a healthcare professional may perform tests to measure your magnesium levels and provide guidance on magnesium supplementation or dietary changes to help restore adequate levels. However, it's important to work with a healthcare professional to determine the appropriate dosage and form of magnesium supplementation, as excessive intake can have adverse effects. And that's a wrap on our exploration of vitamin deficiencies and their role in causing back pain. We hope you found this video informative and eye-opening. Remember, taking care of your nutritional needs is not just about overall health, but it can also have a significant impact on specific areas like your back. If you suspect any deficiencies or are experiencing persistent back pain, be sure to consult with a healthcare professional for proper evaluation and guidance. Don't forget to like, share, and subscribe to our channel for more exciting content. Stay healthy, stay pain-free, and we'll catch you in the next video. Keep rocking, fam.